At Tammy Walker Cancer Center, we have a new state-of-the-art CT scanner. We are only the second in the state of Kansas to have this new technology. I'm Whitney Reid, radiation therapist at Tammy Walker Cancer Center.
Well, Whitney, thank you so much for being on the show. We're going to be talking about a new tool you have at the Tammy Walker Cancer Center, a CT scanner, a new CT scanner. Why don't you tell us about it?
Our new CT scanner is actually a 64-slice CT scanner, and it has many beneficial features for the patient.
Why don't you tell about how's this different than the one you've had in the past?
Our old CT scanner had a small bore, and what that means is the bore is actually the circle opening on the scanner, so when the patient is moving in on the table, they're moving through that bore. So with the increased bore size, it will actually help accommodate many more physiques and body builds, therefore increasing patient comfort on the scanner. And having increased patient comfort will help us produce an accurate and reproducible setup, therefore helping the clinical team create a plan that minimizes the dose and damage to the healthy tissue and organs at risk and everything surrounding the tumor, while maximizing the dose to the tumor.
How do these changes in the new scanner benefit the patient?
Actually, it increases the scan time because they're more comfortable. Okay. We're not having to change the positions and get them in a more comfy spot. They're kind of laying there relaxing, and so it's a faster scan time. We're not having to go back and adjust things. When we're utilizing the 4D scanner, it helps accommodate the breathing cycle for the motion management scans that we need.
Might need you to explain that a little bit. I know what 3D is. What is 4D?
So 4D is, like I said, a motion management. Okay. What it does is it watches the patient's breathing for tumors around the lungs, the diaphragm, and what it does is it will track the patient's breathing, therefore helping the doctor and our dosimetrist, when they're making their plan, avoid issues with if they're taking breaths in, and they can track that tumor and give the correct dose to that tumor in that certain breathing cycle.
For the old system, I understand from talking with you, is you actually had to do that afterwards, right?
Mm-hmm. With the new scan, the 4D scanner and our CT scanner talk simultaneously. So before, we would have to send it to a third-party computer, let it do its thing on that computer, send it back, and then send it on. So with this new scanner, they talk together, so we're eliminating that actual third-party computer, and it's decreasing the time the patient's on the table drastically.
Whitney, thank you so much for some great information and for coming on the show. And thank you for watching. For more information, please visit TammyWalkerCancerCenter.com and like them on Facebook.